To go ahead and bring up our next speakers, Daniel Kiernan and Dr. Pam Lano, who I just learned I've known for 10 years, but she went and changed her name, and so I have no idea who she is. She insists she's the same person, but I don't know. But I'm excited to have her back because she has been involved with the community practice, I believe, almost from the beginning, possibly the original steering team. And so I guess it's exciting to have you back, Pam, as part of the community practice. So thank you guys very much for being here.
Well, thank you for the introduction, and thank you for your time today, the opportunity to provide some information about the Medicaid program in Wisconsin, the mental health services, and broader behavioral health services that we cover. So I'm Daniel Kiernan, Section Chief for Behavioral Health Policy in the Bureau of Benefits Management, in the Division of Medicaid Services, and the Department of Health Services. What all that means essentially is I work with a team of policy analysts and clinical consultants in drafting the coverage policies that Medicaid has for behavioral health, a term that we use broadly to describe mental health treatment, substance use disorder treatment, as well as a specific benefit called behavioral treatment. And I'll get into some of those benefits in a little bit. Those are all what we call non-institutional benefits, so I won't be talking about hospitalizations today, other institutional types of care, talking about those outpatient or home and community-based services. And then Dr. Lano will be joining me a little bit later in the presentation once I've gone through some of that benefit structure to talk a little bit about the authorization process that Medicaid has, where we look at Medicaid members, really trying to look at that individual perspective of a Medicaid member, not just kind of from the benefit silos, for lack of a better word, that we have. So I'm going to go out on a limb here, see if I can follow up on that CPCP. I'm going to guess that we're talking about Child Psychiatric Consultation Program. Yes. Which is a fantastic program, the state's funding, which I think we've heard great results from so far and really appreciate the availability of that resource. That should be on the Department of Health Services website if you're looking for how to connect to that. Want to acknowledge we didn't really coordinate too much as speakers today, but I appreciate, Hugh, your presentation. I think it really does frame what I'm about to talk about really well. What I'm thinking of is that system chart that Hugh had, that axis of parental control and intensity of services, and he highlighted the child welfare system and the juvenile justice system. Some of the components there that weren't highlighted were the outpatient, the community-based supports, the hospital services. That's where the Medicaid program comes in. That's another component of that system. And so I am going to be talking about the nuts and bolts, the restrictions, the constraints of the services that we cover within that Medicaid program. But I do want to acknowledge that we recognize the importance of Medicaid within the broader child behavioral health system. Nationally, Medicaid is the single largest payer for mental health services. That's across all ages. It's about a quarter of total national spend on mental health services, but there's no other payer that has a higher percentage of total spend. So we know that Medicaid policies do influence and impact how mental health services are covered and received through other health insurance programs. And that's a role that we recognize and try to appreciate in the work that we're doing. So again, as I mentioned, I'm going to do an overview of Medicaid, a description of the services that we cover, let Dr. Lano speak a little bit about some of those clinical considerations, and then we have a split session today, so acknowledging Dr. Mortal will be following us as well. What is Medicaid? Medicaid is a federal state program that is authorized at the federal level under the Social Security Act, just over 50 years old now, and administered at the state level by the Department of Health Services Division of Medicaid Services. What that means is there are federal laws and regulations that apply to the Medicaid program, as well as state laws and state regulations. Every state in the country operates a Medicaid program. They all operate them in distinct ways. Medicaid enrollment, there's a wide variety of eligibility categories for Medicaid. You can be eligible based on income, based on non-income factors, including disability. And in Wisconsin, I think really what I want to highlight here is the end of this slide. You might be enrolled in Medicaid as a Badger Care Plus enrollee. You might be enrolled as a EBD Medicaid or an SSI Medicaid, a Katie Beckett Medicaid. Those are all terms that refer to different aspects of eligibility. The Medicaid program in Wisconsin has worked to develop a single set of benefits that is the same across all of those eligibility categories. So no matter how you became eligible for the program, the set of services you've received once you're eligible should be the same. Another concept that I want to just kind of put out there, Medicaid delivery systems. There are two main delivery systems. We have what's called the fee-for-service system, where a healthcare provider provides a service, sends a claim, an invoice to the state, and we pay that provider directly. There's also the managed care system, where the member receives the same service from a provider. That claim goes to a health maintenance organization, HMO, and then the department contracts with that HMO and reimburses the HMO for the services that they've covered. The services are the same, whether you're enrolled in fee-for-service Medicaid or managed care Medicaid. However, and I'll get into this, it's particularly relevant in the mental health and behavioral health world. Some benefits are available on a fee-for-service only basis. Some benefits are through managed care. And I think to the intent of today's program, one of the questions that we were asked is, how do I access mental health services? This is important to remember. If you're in an HMO and the service is covered through managed care, that HMO is someone you need to interact with to connect to that service. If you're in fee-for-service, the provider is the one that you're connecting with directly. So acknowledging that there may be multiple parts of that system you need to contact to access those services. So as I mentioned earlier, we have a spectrum of behavioral health services that we cover. Again, using behavioral health as a broad term, and then here we see behavioral treatment. That is a specific benefit designed for adaptive behavior assessment and treatment. The model that we see most commonly for behavioral treatment is ABA. It is designed to be agnostic, but that is the treatment modality that we see most frequently and is evidence-based, approved by the Medicaid program. Additionally, we have outpatient services, intensive in-home services for children and youth, psychosocial rehab, day treatment, and crisis intervention. I'll give a little bit more detail about each of those. Behavioral treatment potentially is the benefit that many of you listening are most familiar with. This is a benefit that was created in 2016. Previously, the Wisconsin Medicaid program had covered what it called autism treatment under the Children's Long-Term Community Supports waiver. A federal change in policy guidance allowed us to cover treatment under this benefit, under the state plan, so that all individuals in Medicaid have access to behavioral treatment. What that means is you no longer need to be eligible for that waiver, and there are no age restrictions for behavioral treatment under current Medicaid policies. So this is across the lifespan. It's also available for members with any diagnosis associated with deficient adaptive or maladaptive behaviors. It's not an autism benefit. It's where we see autism treatment most frequently under these services, but we would authorize and we have authorized treatment for other diagnoses. This is a fee-for-service only benefit. It's new, and typically in order to contract with a managed care organization, the department needs to have a lot of data about how a benefit is administered. So the department is operating this benefit directly as a fee-for-service only benefit currently. That means if you're in an HMO or if you're in fee-for-service Medicaid, these services are always directly billed to the department. Your relationship is with that provider, not with the HMO. Outpatient services refers to that level of care that our members would most commonly access for mental health services. So we have outpatient benefits for mental health and substance use disorder services, including assessments, diagnostic evaluations, psychotherapy, substance use disorder counseling, other psychiatric services. For children, we have a broad set of allowable places of service. So mental health services can be provided in the child's home, an office setting, school, other community settings. Mental health or substance use disorder diagnosis is required, not for a diagnostic evaluation, but for the psychotherapy services or the counseling services. This is delivered either fee-for-service or managed care, so that's where it does matter if you're enrolled in an HMO. This is a level of service that you would need to be coordinating with that managed care program. Medicaid also has an intensive in-home benefit. This is referring to that same type of service, a psychotherapy session, counseling session, but is a benefit designed to authorize more intensive frequency of treatment. Members eligible for this level of care would need to have a determination of SED. A mental health or substance use disorder diagnosis is required. And again, what's unique about this is the number of hours you could receive is higher under this benefit, and additionally, a team-based approach is allowed. So under the outpatient benefit, it's really just that one clinician. Here, multiple clinicians, including paraprofessionals, can provide treatment in the home when supervised by a licensed professional. That's also delivered fee-for-service or managed care. Psychosocial rehab services is a broad term that describes 3 different programs in Wisconsin. There's the Community Support Program, CSP, the Comprehensive Community Services Program, CCS, and Community Recovery Services, CRS. As we've heard previously, CCS is probably the most high profile at this point. There's been a change in 2014 at the state level that really expanded access to that program. CSP is the oldest. It's been around, I want to say, since the 80s, and is intended for designed to cover what's called the ACT model. So it's a historic high intensity program. If you were to kind of rank psychosocial rehab programs, CSP would be the highest intensity, CCS a mid-range, and CRS kind of a wraparound additional support program. Eligibility for these services are determined through a functional screen. Mental health or substance use disorder diagnosis is required. These are a set of benefits that are delivered fee-for-service only. And that is in part because these are all programs that are operated or administered at a county level. So here is a set of services where your initial contact would need to be the county, and the county will help, I think as Kenya's statement highlighted, determine eligibility for the program, connect you to that program, and the county will be the one who bills the Medicaid program for the services. Day treatment services is a set of programs that include partial hospitalization that are non-residential but provided in a medically supervised setting. It includes a set of case management, psychotherapy, medical care, and other therapies. Day treatment could occur in a child and adolescent day treatment program, a substance abuse day treatment program, or a medical day treatment program, often referred to as adult mental health day treatment. Members need to meet the day treatment admission criteria for one of those 3 programs. The child adolescent day treatment program includes a requirement for that SED criteria. A mental health or substance use disorder diagnosis is required. These are delivered fee-for-service or through managed care. And then finally, crisis intervention services. Crisis intervention services provided to a member in crisis or in a situation that they might progress to be in crisis if supports are not provided. Includes initial assessment, linkage, stabilization services. There are no diagnosis requirements. So the policies for crisis do describe what a mental health crisis is, but there's a recognition that a formal diagnosis is not a requirement to provide a crisis intervention, that those are really intended to be immediate services. They are also a county-administered program delivered by fee-for-service only, so Medicaid will cover crisis intervention, but the county is the entity that's providing that service. Every county in Wisconsin has a crisis program. They should have a crisis hotline. Some counties have regional consortia to provide those services. So when trying to connect in crisis intervention, I think looking for that crisis hotline will connect you to that local resource in Wisconsin. I do want to follow up a little bit on diagnosis requirements. I think throughout this I highlighted where are there diagnosis requirements, where they're not. And I really do appreciate, Hugh, what you clarified and what I want to reiterate. An autism diagnosis does not disqualify anyone for any of these services. That should not be anyone's takeaway when they see a mental health or substance use disorder diagnosis is required. That does not mean an autism diagnosis, someone can't access that service. What it means is someone who has an autism diagnosis should have that diagnosis of the mental health substance use disorder co-occurring. And the expectation is that the provider is assessing that individual on an individual basis to determine that the treatment that they're going to provide will address the mental health or substance use disorder and is effective in the context of the autism disorder. So we're looking not necessarily to say you don't have autism, but that I can address the anxiety issue that is co-occurring with the autism, and I'm providing a treatment plan that acknowledges that whole person, that individual, through my approach. So that's the intent of our policies, and potentially speak a little bit more about how we try to look at that individual member. We have Dr. Lano to give us a few examples. Sorry.
Sorry. So the work that I have been doing, I am currently connected to Department of Health Services as a clinical consultant, primarily around behavioral treatment benefit because that's what I know best. I'm also still in the provider community as a training director. I'm a parent of a really old young man on the spectrum, and have served on the Governor's Autism Council for a lot of years, so I'm pretty familiar with a lot of these issues and also with being an advocate in this area. And have been thrilled with everything that I've seen the department doing in the last 4 years that I've been there. Around behavioral treatment in particular, that is a benefit that requires prior authorization. And some of these benefits require prior authorization and some don't. So that's, you can help clarify that.
Thanks for the reminder. So in 2017, the department removed prior authorization criteria for outpatient. Which means the benefits that I ran through, the only benefits that currently require prior authorization are the intensive in-home benefit, the day treatment benefits. Those are the two areas where mental health or substance abuse services have prior authorization.
Right. So that means for the others, providers can provide and simply bill Medicaid for those. Correct. Without having to go through a prior authorization process. For the benefits that do require prior authorization, the idea behind that is really to give the department the opportunity to look at the individual circumstances that are causing a provider to request services on behalf of a member. And really and truly in prior authorization, our goal is to have a good understanding of what is it that's going on with this member. And how are the proposed services expected to help improve their condition in one way or another. One of the things that I've learned in my work at DHS is that prior authorization and determining medical necessity isn't really about determining whether or not the member has medical needs. They're in Medicaid. We're pretty confident that most of them have medical needs. But we're looking at a plan of care to determine whether that plan of care makes sense and is likely to accomplish improvement of the symptoms that they're intending to improve. So it is very much looking at individual circumstances and really trying to look very holistically at what is going on with the individual, whether it's a child or an adult. Behavioral treatment is a lifespan benefit, so we're looking at everybody. In many cases, we know, so as behavioral treatment has evolved as a benefit, as Dan mentioned, that is predominantly serviced by providers that do applied behavior analysis, or ABA. Those providers historically were a lot of clinical psychologists. Now, increasingly, the providers who are doing ABA are board-certified behavior analysts. That's appropriate if you're going to do applied behavior analysis. But those are individuals who don't necessarily have a mental health background. That is not part of the scope of training for people who get a certification as a BCBA. And so because of that, often when we're looking at plans of care that are submitted for behavioral treatment, we do see situations where individuals clearly have mental health needs, where we can see that perhaps it's an anxiety disorder, perhaps it's depression, perhaps it's an individual with reactive attachment disorder, somebody who has bipolar, something that mental health clinicians are trained and equipped to support, more so than behavior analysts. In those situations, through the PA process, our PA reviewers, who are all BCBAs who have worked in the system in the state of Wisconsin, see that and recognize when that is perhaps beyond the scope of practice, and they often will push back and encourage those providers to, are you connecting this member with mental health services? And if you are, how are you coordinating? Because we really want to see that kind of the whole picture of the intended care is going to meet the individual's needs well, and address all of those pieces to the greatest extent possible. I think our goal with Medicaid is to make sure that, access issues are an issue for individuals with autism spectrum disorder. We know that there are parts of the state where it's an even bigger challenge. I feel like Medicaid has worked hard to make sure that funding is not the big access issue. We do know that there's a problem with enough providers that are willing to serve this population, enough providers that are willing to serve adults in this population as well. But I feel like Medicaid has worked really hard to make sure that Medicaid at least can come alongside from a funding perspective when plans of care are well designed to meet individual needs. So that's, a lot of what we're looking for. We really and truly do, in behavioral treatment at least, have a team of people who recognize when mental health stuff is happening and when it needs separate attention. And it is possible for members to have both behavioral treatment and potentially a mental health service happening at the same time. When that's happening, our reviewers are usually wanting to make sure that good communication is happening between those professionals, because that's how you have the best outcomes. But that is very much on our radar and very much what we're looking for with prior authorization. Other things that seem important? Yeah. Those are the things that I want people to know. I feel like I've been flying the flag to let people know that behavioral treatment is now a lifespan benefit, because my kid is no longer a kid. Okay, he's always a kid, but he from an age eligibility perspective would be in the adult system. And lots of other people who have been advocates for a long time have those old kids as well. So I'm encouraged that that's something that is available, so I want to make sure that people know that. Our biggest thing in prior authorization is really trying to get a good understanding of what's going on, so that we can make sure that good services are being provided. So that's sort of on the clinical side of this, is really and truly just trying to get an understanding of individual circumstances. We recognize that every situation is unique, every situation is complex, and the more we understand and are kind of on the same page with providers, we're in a better position to be able to say yes to those services.
So
yeah.
I think we did also want to just make sure folks had a chance to connect to resources. I think we've probably used the term complex or complicated quite a few times here. Right. We recognize we're not going to be able to cover all of that complexity today. Here are a couple resources that provide information and context both about the general Medicaid program. That's that first link that we have highlighted there, a link to our online handbook, which has much more detail about those coverage policies for each benefit. I will acknowledge up front, the online handbook is an old website and it is hard to navigate. So acknowledge that it may require a few clicks to get to where you're going in the online handbook. To support you in that process, if it's something you want to review and look at and gain a better understanding of, we have call centers. Forward Health has the member services center that I've highlighted. Just want to acknowledge for the providers, there's also a provider call center. So looking at that Forward Health website, linking to those call centers, you can have someone on the phone who can help you navigate some of those resources if that's something that you're trying to gain access to.
Mm-hmm. And in that online handbook, which I'm in, I think, virtually every day that I'm at the state for one reason or another, because that is our published policy for each of these benefits. The online handbook is designed with different sections and so on. The section that is labeled covered and non-covered services, I feel like usually is where you'll find the best description of what a benefit is supposed to be. There's a lot of other information because it's a policy manual for providers. There's a lot of stuff on claim submission and PA submission and things that may or may not be at the front of your radars, things that you need to know. But trying to understand the basics of covered and non-covered services is actually the thing that you're probably going to be, that's probably going to be your starting point in the online handbook. So I just mentioned that because it is a little tricky to navigate. That may be some of your most useful information when you start diving in there. So, okay.
Well, I'd like to thank you both very much. And again, hard to take questions from 700. So luckily they will be available here for a little while after the next break to answer these questions. I am curious though, just to sort of clarify, because there's a lot of different terms that have been used. So Forward Health Handbook, that applies to what you were talking about, the Badger Care Plus, SSI Medicaid, Katie Beckett Medicaid. That's all covered under Forward Health.
Yes.
So they don't go looking for a Badger Care Plus handbook. They're looking for the Forward Health.
Yeah, actually when they go on the site, when you choose the online handbook, the first drop-down says, the first drop-down box has different options, and you choose Badger Care Plus and Medicaid, and that covers all of the things that Dan talked about. And then your next drop-down is the specific benefit area. So you might choose behavioral treatment. You might choose child and adolescent day treatment. Any of those benefit areas that he covered will each have their own policy manual. So.
And I apologize if I was dealing with other things. But so the behavioral health benefit under Medicaid, prior auth or no prior auth? How do they access that? Behavioral treatment.
Which is
Sorry,
ABA.
behavioral treatment, ABA.
Is PA'd.
Okay.
So and that one again is a fee for service. It's a new benefit, so you're not going to go through your HMO. They go directly to a provider that provides that service, and that provider submits a prior authorization to our team at DHS.
Fantastic.
Yeah.
I know that's one of the, one of those in, figuring out the system, how do I navigate the system to get the benefit? Mm-hmm. So thank you so much for addressing those things. I'm hoping we'll be able to have the slides available if they've been okay. I've worked with DHS for a while and knows, some things don't ever leave the building. So that would be great. So we will work on getting all of the slides that are